Today, you will be hearing from Utah Governor Gary Herbert, from Utah Lieutenant Governor Spencer Cox. He will be followed by the Director of the Office of Child Care in the state, Tracy Gruber. We'll also hear from Executive Director of the Governor's Office of Economic Development, Val Hale. And finally, we'll have the daily briefing from that you've come to accustomed to from our state epidemiologist, Dr. Angela Dunn. So I'll ask us to welcome the Governor of the great state of Utah, Gary Herbert.
Well, welcome everyone. Again, we're honored to join with you today on what we call our daily briefing. I'm interested in making sure that we have a daily briefing, or as necessary, to make sure that the public is informed as far as what we know and what we're doing, so that they can join with us. We hope to eliminate some of the uncertainty that's out there in the marketplace, and certainly help eliminate some of the fear of the unknown. So count on these briefings to happen daily. Let me just kind of review a little bit here. As everyone knows, we have this COVID-19 pandemic that's encompassing the world. And everybody's trying to find a way to address that issue. And here in Utah, we've had the best minds gathering together to develop a plan, an action plan of what we can all do to help slow the spread of the COVID-19 virus, and to make sure that our economy continues to not only survive, but to thrive as we have an opportunity. This is kind of a difficult stretch of road right now that we're traveling, but we believe that we can, with a good plan, we can get through here with minimal casualties along the way, and hopefully emerge stronger than ever before. As the plan says, we have 3 phases. You'll remember we talked about the urgent phase, the stabilization phase, and the recovery phase. And I need to remind everybody that we are in the urgent phase now. We're doing things that are important in the urgency phase, which is like testing, ramping up our testing. As I've mentioned before, the biggest challenge the country has been facing is the lack of the ability to test everyone. That would be nice. We don't have enough. Now we're just testing those who have the symptoms of the COVID-19. We're doing about 2,000 a day. But we want to ramp up to do 7,000 a day, and in doing so, that's going to help us reduce the transmission rate. That's the single goal and the purpose, really, of the urgent phase, is to reduce the transmission rate of the coronavirus, and in doing so, we will ensure that we do not overwhelm our healthcare system. Now, those areas of the world and in our own country that have had the biggest problem is where they've not been able to do that. The healthcare system has been overwhelmed, and then that's when we really start to have problems. So our goal is to, again, to drive down the transmission rate and to keep from overwhelming our healthcare system. And that's why I just need to emphasize the next 2 weeks are critical. The next 2 weeks are critical if we're going to be able to do this. And everybody has a role to play, and everybody needs to be engaged. We have introduced here last Friday our overall slogan of stay safe, stay home. There is no better place for people to be if you're concerned about catching or giving the coronavirus other than your home. And so again, we encourage everybody to stay home and stay safe. I know this is an inconvenience. We are social animals. We like to engage with family and friends. And this is very disruptive to our normal way of life. It's contrary to what we're used to doing, and is certainly hard to do. But again, let me emphasize, the next 2 weeks are critical. So everybody kind of recommit themselves to do what they need to do to stay home, stay safe, and avoid contact with people. I know there's a lot of questions about work. So let me talk a little bit about the work. Again, we think that employers and employees working together, this is not one versus the other. That should be a partnership. making sure that we have opportunities where it's possible to telework. With the technology we have today, this is much easier than it's ever been in the past. So teleworking does work, and it's something we can do. And we see out there, and I'm grateful for the business entrepreneurs and the employees out there for saying, well, we could do this a little different than we've done in the past and still be able to provide the goods and services that our businesses have been doing to the public for many, many years. So again, telework wherever possible. Again, we're encouraging people to make sure that they have strict distancing between people. The guideline from the CDC is 6 feet. That doesn't mean that's the minimum, by the way, so it can be more than that. But space your employees out, employers, and make sure that they have a safe environment. That includes hygiene protocols, hand washing, hand sanitizer, wipes to clean hard surfaces that have the ability to maintain the virus for a period of time. So again, hygiene protocols are absolutely important if we're going to continue to have work to take place. And again, I think the phrase that we've used is that we need to adapt and then innovate. Again, we have rules we've got to follow. We need to adapt those rules, but we can innovate and find ways to put those parameters in place and not break protocols and still continue to have our business opportunities out there. So adapt and innovate. And if we do that, we've said you'll be able to overcome. Again, guidelines for business, but particularly from employers and employees working together will help us, I think, address this issue. At the state level, we have not identified any essential businesses per se. We have some that are probably not as essential as others, but that's kind of sometimes beauty is in the eye of the beholder, essential is in the eye of the business, and all want to be essential. So we haven't identified those by name or category, but we have identified parameters. And no matter what the business is, we expect those parameters to be met. Again, social distancing, physical distancing, hygiene, screening of employees when they come to work, making sure they don't have fevers or have any symptoms, screening of customers when they come to buy your product or your service. Again, making sure that they don't have symptoms that would tend to have others be in an unhealthy environment. So that's something we expect business to do, and they can, and they should. We've also allowed for some regional variation. We believe that every part of the state is not exactly the same, certainly when it comes to the coronavirus. And so we have protocols in place for having people stay home. We've closed the state parks and said that those are only available for those who live in that county where the state park resides. Again, to slow people from outside that may bring the virus to a local community, which right now is maybe sterile. So again, that's going to help us over these next 2 weeks. We also are allowing for some flexibility with local governments and the local health departments making some nuances. So currently, I emphasize currently, there are some flexibility. We don't expect a lot. But if we need to change that because people aren't abiding by this, then we will do some changes. Again, I'll just emphasize, we cannot identify every single scenario or situation that could happen in the marketplace. So you don't have to have instructions on every single thing. You need to use a lot of common sense and use your own best judgment and following the parameters as far as what the protocol is for businesses to operate. So we'd encourage you to do that, and we would say, use self-control. We expect you to have self-discipline, self-control, self-enforcement, and self-impose upon yourself. We don't need to have a policeman following you around, making sure that you, in fact, follow these protocols. So use some self-discipline, self-control, self-enforcement, and self-impose upon yourself these protocols. Now, let me just add a couple of other things in conclusion. One, I want to thank our young people because they are key to our success on this. We appreciate the young people for what they're doing to slow the spread of the coronavirus. I know this is not easy. Again, for our young teenagers and young adults, that probably is a bigger challenge than some of us maybe realize. We forget what it was like to be young. But they are key to our success. Let me just say that we see more of our young people they kind of had the attitude that we're invincible. And there has been kind of a message going on out there that young people can't catch the coronavirus and maybe are immune in some way. And that's not the case. That's not true. Let me just give you some statistics. You may think you're invincible, but you absolutely are not. 15% now of the confirmed cases are under 24 years of age. 15%, and it's growing. 42% of confirmed cases are between 25 and 44, so still pretty young. 32% of confirmed cases are between 45 and 64, and only 13% of confirmed cases are over 65 years of age. So all of us are susceptible, and more so in the younger populations, more so than probably was originally believed. Hospitalizations, approximately 8% of the cases that we have been hospitalized. You get to the hospital, that means you're in a serious condition. And of those who are hospitalized, 44% of those require care in the ICU. So we want to keep you out of the hospital. Let's make sure we do our prevention efforts so we don't catch it and don't spread it. Of those in the ICU, 3% of hospitalized cases are 24 years and under. 18% of the hospitalized cases are 25 to 44. 48% of those hospitalized are between 45 and 64, still pretty young. And 31% of the hospitalized cases are 65 years and older. So it does appear that there's more serious impacts on those who are older, but still don't delude yourself by thinking that because I'm younger, I'm not susceptible to the coronavirus. Now, let me just conclude by saying there is some good news. Help is on the way. We are in constant contact at least 2 or 3 times a week. I'm in contact with the president and the vice president. Once a week, I'm in contact with the governors throughout the country as we share best practices and learn what's taking place so we can use their experiences to help us to have a better experience. So good communication between us and the other governors and between us and the White House, and the weekly briefings we get with them twice a week have been very helpful. And because of those briefings, that we've had some ability to have input into the CARE Act. And again, as most people know, that's $2.2 trillion that's going to be coming here in the next few days and maybe a week to help us with some of the relief efforts we need to have for employees who are out of work and for employers who are maybe losing their business and laying off more people and rising unemployment rates. So we're trying to find ways to, in fact, bridge the gap. This is, again, a stretch of road here that's pretty rough, but we're going to see what we need to do to get through that so that we can, again, not only survive, but then continue to grow and come back to a healthy economy situation here by hopefully the end of summer. And I think that's very doable and very possible. Let me just mention again that Val Hale from our Office of Economic Development will talk to these issues here in a few minutes. And more of this will be coming out here the next couple of days as we have these daily briefings to give you more information about some of the good things that are happening and what's taking place, and report back to the people of Utah how we're doing. So with that, again, let me just conclude saying I know that we're going to be successful. It's only a matter of how long. We want to do everything we can to shorten that length of time. We want to bend the curve. We want to flatten the curve. We want to keep people employed and working and make sure that we protect people's health, which is the number one goal for all of us. With that, I'll bring in Lieutenant Governor Cox, who's chairing our task force on this, and we'll have him speak and talk about some of the things we're doing now with our children and some help that's coming in that regard. So with that, Lieutenant Governor Cox. Oh, okay. Sorry. Yeah, that's probably a good idea. Thank you. I'll take a couple of questions if anybody's got a couple of questions.
Hi, I was wondering what the current modeling shows that you guys are using in terms of when we would run out of hospital bed ventilators and what you're doing to prevent that from happening.
We do have our Office of Management Budget headed by Kristen Cox, working with the medical team that we have here at our different hospitals. And it's particularly at the top of the list is Intermountain Healthcare, which is the largest provider of healthcare in the state. with those involved with the data collection and science have done a very remarkable job of trying to analyze the data. We'll have more information on that probably in the next day or two as we roll this out. But we know that if we don't do anything, if we didn't do anything, that the hospital beds would be taken up. We have about 512 of these ICU beds in the state, which maybe seems like a lot, but it's not a lot. And again, we've never had anything like this before. But if we don't bend the curve, then that's the problem. That's what's happened in other states and other parts of the world. They overwhelm the system. The hospitals are having to make shift and out in the streets and not in very sanitary places. More information on that will come in a couple of days, but that's the whole point while these next 2 weeks are critical. If we do what we're saying to do, if everybody participates, we'll have hospital beds for those who need it.
All right, thank you. Governor, some of the information you gave us, the data is really helpful, but it's not available on the website. Every neighboring state has a whole lot more information about the nature of the cases, the age of cases, age of death, the gender of cases and death, the rate of cases, hospitalization by age, the exposure. All of these things are available in our neighboring states, but not on Utah's public site. Is that something that is going to change?
Absolutely. Thank you, Max. It's a discussion I had this morning with our team. Our coronavirus.utah.gov site should have that information currently. And I've had some complaints over the weekend that we're not giving as much information at that site as we're capable. Again, we've done a lot of detailed analysis. We want to make sure that what we put up is accurate, not just pie in the sky or just wishful thinking. But I'm going to make sure that that happens hopefully in the next 24 hours, that we'll have all that information up and it will remain current. You'll hear from Dr. Dunn here a little later on today, and she'll give you some information, too, as far as what's taking place. We're doing a lot more testing, and about 5% of those who test find that they have, in fact, the coronavirus. So we're doing better than most states, frankly, at this stage of the game. We're about 2 weeks behind with the rest of the country, which is a good thing, by the way. That's just how things have kind of played out. And it's given us a chance to learn from others' experiences to make our experience better, as I mentioned earlier. But that will be up in the next 24 hours. Thank you, Max. That's it, and we'll bring in the Lieutenant Governor now.
Ladies and gentlemen, we recognize that the closure of schools and many child care centers as part of the COVID-19 pandemic has created both an increased need and a lack of access to child care here in the state of Utah. This issue is most critically felt among our most essential employees working on the front lines to keep our communities safe and healthy. Our health care and public health workers, our law enforcement and first responders. We knew this from the very beginning, and so a couple weeks ago, the COVID Community Task Force reached out to our Department of Workforce Services to start working on this issue to make sure that as the number of cases began to increase in the state of Utah, that we would have appropriate child care available for those on the front lines. Today we are announcing the launch of One Utah Child Care, a system of free temporary child care centers specifically serving the families of these essential employees. This program is accurately named as it represents the efforts of many individuals and organizations coming together as one Utah to meet the critical needs of our communities. Tracy Gruber, Director of Utah's Office of Child Care and lead of the Child Care Task Force, will now explain the details of this new child care system. Tracy?
Thank you, Lieutenant Governor. Tracy Gruber with the Utah Office of Child Care. A few weeks ago, we were asked to develop a plan to address the anticipated need of child care for Utah's essential employees in healthcare and in public safety. And to address that need, we assembled the COVID-19 Child Care Task Force, which is made up of representatives from hospitals, education, business, child care providers, faith-based organizations, and the Department of Health. This task force understands that childcare is critical right now to keep Utahns working. And it's important to note it can be done safely. This task force is following the structure that was established in the Utah Leads Together plan, focusing on an urgent phase, a stabilization phase, and a recovery phase. And today, we're announcing the launch of One Utah Childcare during this urgent phase. Starting today, families with young children who are essential employees can go to jobs.utah.gov and register for free childcare in various locations throughout the state. Beginning this week, there will be at least 10 programs online to provide this childcare as soon as Wednesday, with more coming online throughout the week and in the weeks to come. We're continuing to onboard sites every day so that we can make sure that families serving our state's health and safety needs have access to childcare. These sites will be open Monday through Friday from 7 a.m. to 6 p.m. to cover the hours in which schools are no longer opening. School-age sites will provide time for distance learning activities so kids can stay engaged with their schoolwork while they're attending these locations. The locations will be staffed by individuals who've received background checks and have received pre-service training through child care licensing, and they'll remain open for as long as schools are closed. In addition, for our essential workers who aren't going to be able to use these sites, maybe they're working overnight shifts and on weekends, the One Utah Childcare System is maintaining a list of caregivers who have been background checked and have received pre-service orientation, willing to work in people's homes, and those arrangements will be made individually between the essential employees and those caregivers. One Utah Childcare does understand that this system is not for everyone who still needs childcare, and there's lots of workers who still need childcare to keep Utah up and running. There are lots of childcare providers throughout the state of Utah who are open and have capacity and are practicing social distancing and other safety protocols to reduce the spread of the coronavirus. And parents can feel comfortable using those locations that are currently open. Utah's Care About Child Care system can help these families also find care. And finally, the Department of Workforce Services does offer child care assistance to these workers who still need to show up for work. The eligibility for child care assistance has been expanded, and we encourage families that need child care when they didn't previously to contact our office for that information. Thank you. Oh, sure. I'm happy to take questions.
I want to thank Tracy and her team at the Department of Workforce Services who have been so engaged over the past 2 weeks working on this project. So much of this is like building an airplane while flying it, and they've been able to respond in just incredible ways. Now it is my pleasure to introduce Val Hale, the Director of the Governor's Office of Economic Development. As many of you know, as I think the Governor talked about earlier, Congress recently passed a stimulus package with relief for so many small businesses in our state. And we're pleased to have Val Hale here to talk about the Utah Leads Together Small Business Bridge Loans. Val?
Thank you, Lieutenant Governor. As he mentioned, my name is Val Hale, Executive Director of the Utah Governor's Office of Economic Development. GOED is pleased to announce the Utah Leads Together Small Business Bridge Loan Program. This program offers bridge loans to Utah-based small businesses with 50 or fewer employees. And these businesses obviously have been impacted by the COVID-19 pandemic. The bridge loan program will use approximately $8 million in repurposed state economic development funds, and we hope to add more funds in the future. We will use a minimum of 25% of the funds for rural Utah businesses. Loan amounts range from $5,000 to $20,000 with 0% interest for up to a 60-month period. There will be loan payments will not be required for the first 12 months of the loan. Loans are for businesses and cannot exceed 3 months of demonstrated operating expenses. GOED will determine the eligibility of the bridge loan applicants. Applying is not a guarantee of funding, and preference for funding will be given based on specific criteria that are available online. The website where businesses should go to find out information about this program is coronavirus.utah.gov. Businesses will be able to apply for the loan starting tomorrow morning, March 31st at 8 a.m. Mountain Daylight Time, and the first funding tranche ends Friday, April 3rd at noon. And then we will open up applications again the following week for the second tranche. So that's the information we have about this program. It's designed to help small businesses hopefully bridge to the funding that will come through the SBA and other loan opportunities. Questions?
Hi, is that funding available also to nonprofit organizations?
For this first tranche, it will not be. In subsequent tranches, that's something that we will consider. But this first go-around is going to be for businesses only. The question was if this will also be available for nonprofits. And the answer is not for this first round, but subsequent rounds we will consider that. Thank you.
All right, good afternoon. I'm Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. We're up to 806 cases in Utah right now. Yesterday, we were at 719, so that's an increase of 87 cases and a 12% increase. We tested just over 16,000 people so far in Utah. That was over 2,000 results that came in yesterday. Unfortunately, we did have to announce 2 other deaths over the weekend. So we're up to 4 total deaths in Utah, 1 from Davis County. So that's a total of 2 deaths in Davis County and the first death in Salt Lake County. So the governor did mention that we have an 8% hospitalization rate. And even though that rate is small compared to our other states, if we continue to increase at that rate, we will overwhelm our healthcare systems in the coming weeks. However, we do have early numbers that show us that social distancing is working. 10% of our cases are community spread. That means only 10% of the people who have COVID-19 don't have a clear source of exposure. So we're not growing as fast as our neighboring states. That means social distancing is working. And the point of social distancing is, yes, to keep you safe and you healthy, but also to prevent you from potentially infecting others who, if they got COVID-19, they would have to go to the hospital and receive a high level of medical care. So by adhering to social distancing, you are allowing our healthcare providers to provide quality, safe care to those who need it most. And you're keeping our precious resources of ICU beds, ventilators, and even general hospital beds available for those who are going to need that high level of care. So I want to thank you for adhering to the social distancing recommendations that we have put forth as a state and continue to do so until we start seeing a steep decline in our cases. Thank you, and I'll open it up for questions.
Yeah, Dr. Dunn, Colorado counts among its cases that are presumed to be positive because they either live with somebody who has the disease and are symptomatic, something like that.
Yes.
Does Utah keep account of that?
So currently, what we're posting on our website and presenting publicly are just laboratory confirmed COVID-19 cases. Some of our local
Does Utah keep account of that?
So some of our local jurisdictions have been doing that on their own, but there has not been a statewide process. Our recommendation, because of our increased capacity in testing and the stand-up of our alternate specimen collection sites, is that anybody who's symptomatic get tested for COVID-19 so that we can actually confirm the cases. So that is our current practice.
What can you tell us about the patient who died in Salt Lake County?
So the patient that died in Salt Lake County was between the ages of 18 and 60 years old. And I'll refer to Salt Lake County for further details on that.
Hi, Angela. Do you know if there are any confirmed or presumptive cases in nursing homes or jails across the state?
So we don't have any cases or presumptive cases in incarcerated populations. We have investigated a few cases in long-term care facilities and have identified one. However, that person was identified early and no healthcare workers were infected as a result of that. So our long-term care facilities are doing an excellent job in terms of screening visitors and screening their employees to prevent introduction of COVID-19 into their facilities. So the test that is used to detect COVID-19 actually detects the viral RNA in a person's sputum or blood, and it is very, very sensitive. That means we have a very low false negative rate. So we are confident that when a patient tests negative for COVID-19, they don't have any of the virus circulating.
Yeah, there was a Politico story about how the FDA has issued emergency authorization of the anti-malaria drug for coronavirus care. What can you say about, is this promising? Is this not all that promising? Or what does this mean for you guys?
Yeah, so I mean, I think it's great that there are medications out there that are being researched and evaluated to determine their efficacy against COVID-19. This FDA emergency use allows providers to use their discretion to prescribe these certain medications for those patients who have COVID-19. And that's a good thing so that we can further understand how to best treat COVID-19.
Thank you. Does the health department keep track of numbers of patients who have recovered or tested negative after receiving a positive test?
So the good thing about COVID-19 is that over 80% of our cases nationally and 90% of our cases in this state recover on their own at home without needing any medical intervention. But because of that, we don't have accurate numbers in terms of actual recovery numbers because so many people are just recovering on their own, which is fantastic. We do use the mortality rate as a marker for those of the severity of disease in Utah. And right now at 4 deaths and only a 5% positive rate, the severity is low in Utah, but those social distancing measures are contributing to that. So that's something we just need to keep doing as a society.
Hi, Angela. Do you think that the relatively low numbers of cases in rural Utah reflects reality or the difficulty of obtaining tests there?
Yeah, so we do know that there is some limitation to access to testing in our rural communities, and we're actively working with our healthcare system partners to establish mobile testing sites for these communities so that everybody has access to COVID-19 testing that has symptoms. It's also important to realize that COVID-19 spreads more easily in the urban setting because it is person to person and relies on that close contact with sick people in order to spread. We know nationally that the vast majority of counties that have no COVID-19 cases are rural, and I think that's reflected in our Utah population as well. However, we want to make sure that there is access to testing, and we're doing that now.
Dr. Dunn, Wasatch County, it appears, has just issued its own stay-at-home order. Are you aware, are other jurisdictions beyond Salt Lake and Summit County and Wasatch County now looking to adopt their own orders?
Sure. So I'm not aware of any other specific counties that are looking into it. We definitely support those jurisdictions that choose to go that route. It can definitely slow the spread of COVID-19, and so we just work to support their decisions. Yeah, so, we do recommend that people traveling into the state of Utah from those high-risk areas. Right now, it's Connecticut, New Jersey, and New York, actually quarantine for 14 days when they get here, similar to what we were doing with other countries with high spread of disease. And of course, our messaging that, you should isolate upon symptoms will help prevent the spread of COVID-19 in Utah as well. Sure.
Go ahead.
Yeah, I was wondering, have you tracked down all individuals who came in contact with Rudy Gobert during his 14-day incubation period?
Yep, and that's a regular public health practice, and we do that within the first 24 hours of identifying any positive case. We're able to track down all close contacts who are at risk for developing COVID-19 from that specific contact. Okay, thank you guys so much. I appreciate it.
That will conclude today's briefing. Thank you very much.